So as we're approaching your surgery day, kind of advancing through, it's kind of funny. Every time I saw you either out in public, it's like, okay, it's going to be this year, it's going to be this year. So I'm just like, waiting, and finally coming to the office and, okay, I think I'm ready. I'm getting enough skin, particularly in my neck, that I just believe that the non-surgicals are just not quite cutting it. So maybe go through a little bit about some of the fears you had and concerns, just kind of going in and questions and stuff you had.
Yeah, that was really important to me. I mean, I remember that, every year, at the beginning of the year, you start thinking about what is it that I really want to accomplish. And in 2024, November, I turned 60 years old, right? And so as I look, big one, yeah. Although thanks to you, people are like, you don't even look like you're 40. So thank you, Dr. Bengtson.
Yeah, exactly.
So as I was approaching, as I was looking at that, 1 to 2 year span, counting down to my 60th birthday, knowing that I really feel great on the inside, and also knowing that for women, and I don't know if this is true for men too, but when you get older, if you're carrying some extra weight, that tends to make you look younger. And for me, that wasn't an option. I didn't want to sacrifice having low body fat for having a more youthful appearance to my face. So as I was thinking about, when am I going to do this facelift? I thought, well, I need to go in for a consultation. So we met in your office and you came in and you said, Terri, I really think that this probably is the time. You have stretched out this process long enough. But you were very honest and you said, we're going to do this in a way that, number one, does not change how you look. What it's going to do is really restore how you looked 15 or 20 years ago. And so as you walked me through your strategy and your philosophy and really what the approach is that you believe is the right one for having a facial and neck cosmetic surgery, as you shared with me that, I just really trusted that was the right approach, because you said we don't stretch.
Right. Yeah, so it's really interesting, particularly in West Michigan. I think some patients come in and they're like, oh, I don't want a facelift, I just want a neck lift. And some are like,
that was me. I'm like, you gotta get the neck and
the chin.
So, the neck and the chin, that was my big area.
So it really is kind of getting to what specific concerns patients have, and then, talking about what we can do to enhance or improve those. So when it comes to surgery, there are a number of different things that have kind of changed in the past, probably 10 years, 12 years, that make it much more exciting for me, because we can get patients through it with really exceptional, good long-term outcomes, but much faster recovery. And so I'm gonna look through, I think that we took photos of you 1 week post-op. So, when we have this presentation or this webinar, we'll show some of your before and afters and stuff. And I think we have one of you just 1 week after surgery. If not, we'll find a patient who's just a week out. So the first big transformational thing that we do is we put fluid underneath the skin that has some pain medicine in it, like a lidocaine numbing medicine, but we really use it for the epinephrine. So it has a very dilute epinephrine that shrinks all the blood vessels. And when I first started doing this procedure like 25 years ago, patients were very black and blue, very swollen. Took a lot longer to do the surgery just because of the bleeding and stuff. Now we put fluid in and there is almost no bleeding. I mean, the main bleeding we get is right when we make the skin incision. But as we're doing the surgery, there's almost no bleeding. And so the epinephrine kind of isolates the little blood vessels, and we can coagulate or cauterize those before they bleed. And we see all patients back the next day. So patients come back and it's well over 90% that have no bruising. I mean, minimal swelling, particularly thinner faced patients. And then they're back a week later to get their sutures out and can kind of almost get back into, society. So that one thing, no more drains because there's no bleeding, much quicker recovery, less pain, less swelling. But that one thing that we do is it just really transformed this operation. I don't know if you remember, that aspect of things, or how much bleeding and bruising you had.
I do remember I had absolutely I had absolutely no bruising. And I had very little swelling too. And I think that all of that was, it's the way that you walk patients through, not just the lead up to the actual day of the surgery, but then as you send patients home, and then that 24-hour appointment. I mean, all of that was designed to, in my opinion and from my experience, make it so that it was a really easy first 24 hours for me. And then you talk about that post-op time. I had taken almost 2 weeks off from work, not really knowing exactly what I was going to need. I had the surgery on a Monday morning, and by Wednesday of the following week, so less than 10 days after surgery, I was part of a huge community event with Tim Tebow, where I've got pictures I'll share with you that nobody would have even known that I'd had surgery. It was remarkable.
Yeah, that's cool. He's a cool cat.
He is a great guy,
I met him too. He's a neat guy. So, I mean, when you have patients that bruise more isolated bruising from the injectables than surgery, I mean, it really says a lot. So I think that's the first thing we do differently. The second thing is we used to make incisions up into the hairline, back into the hairline. It created alopecia or hair loss in the scar and kind of step-offs of the scar, and kind of a big negative incision in the front of the ear. Now we go beneath the sideburn, back behind the cartilage, so the incision is kind of back behind and hidden, and then back behind the ear in front of the hairline. So the incisions are much more well hidden. So when somebody's looking at you from the front or from the side, there's really no visible scar. So particularly in your line of work and profile, I think that's another thing that's really a big improvement.
Oh yeah, I had talked to some people, some friends of mine who had facelifts years ago, and they were just surprised. We were comparing, hey, look behind my ear, and they just couldn't believe that virtually invisible. Like you almost cannot see anything.
Were you concerned at all about just like being overly tight or overly done? Because I see a lot of patients, when I'm out traveling and stuff, and it's like, wow, I mean, it's so overdone and tight. And I think, some patients are actually looking for that, but in West Michigan, not so much, so.
Right, and that was, when we had our first consultation and you explained your philosophy and you said, I don't believe in just pulling it back. He said, I really want you to have a very natural look. And I 100% know that that's what I got. And most people have no idea that I had anything done. And I think that's the point, right?
Yeah, absolutely.
They think you look great. They think, I can't even tell you how many people, when I say, look, I'm turning 60, cannot even believe it.
Yeah, the best plastic surgeries in patients, you can't tell them had it.
Can't even tell, exactly. They just want to know what your secret to the fountain of youth is.
So, I think, and technically what's happening in surgery is we are lifting, there's a structure. It's a hard thing to kind of communicate, but I think the best analogy, it's not perfect, but you take a piece of chicken and put it on the counter and you pull on the skin, the muscle kind of comes with it. So there's a structure that covers the muscles of our face, and we basically elevate that in a separate layer from the skin. And so it totally smooths the jawline out. And the big thing it does, it takes the load off the skin, so the skin doesn't have to work to hold things up. A lot of plastic surgeons and non-plastic surgeons that do a lot of cosmetic surgery in the United States, they don't tighten that deeper layer, and they're relying on the skin to over tighten it to hold up those deeper structures. And so I think that's when you get kind of the pulled looks in the mouth and just an over tightened, sort of a look. We do take every millimeter of skin out that we can, because there is a little pent up elasticity in the skin. And so we need to take every millimeter to avoid that over laxity. And occasionally we'll come back and do some skin tightening and stuff in the areas a year or two later for patients that just want that a little bit of extra tightening. But those are the things that are kind of happening in surgery that we're trying to make a patient from minute one not look over tight or over operated, but very natural, but also getting a nice 90-degree angle to the neck, nice smooth jawline, all those things that we're trying to achieve surgically. So.